Gray, Hani, bonjour, hello. My name is Leonard Benoit. I am Halabu Mi'kmaq. My people come from the territory of Newfoundland and Labrador. My spirit name is Circling Wolf, and I'm Wolf Clan. I am very honored and very gracious to be sitting in with this chat this morning, having a discussion, very open, very frank, about vaccine and hesitancy within the Indigenous community. This is not to sway any decisions one way or the other. This is to have a open conversation, very frank about where we are, our own opinions. It's not to influence anyone. It's just to have a dialogue about, the relationship between health and culture and what that means within the Indigenous community. So I am now going to pass it on to another one of the wonderful people that's on the panel with me this morning.
I am Ojistoh Horn. I'm Kahentinetha's daughter and Waneek's sister. And I'm from Kahnawake. Right now I'm in Akwesasne, where my father is from, Bear Clan. I'm a physician, family doctor. I've always worked in my communities of Akwesasne and Kahnawake. And I'm on the front lines of this COVID response. I have a lot of patients who have had this infection, and I know firsthand what it's like to take care of our people and the fear. So I am on the other side of this perspective because I have the means with which to look at the information and sift through it. And so I understand that the most important person that I need to talk to and educate would be somebody like my mom. And so that's why this is a really important conversation to have. Thank you.
My name is Waneek Horn Miller. I'm little sister to Dr. Ojistoh Horn, daughter of Kahentinetha, and I am from Kahnawake and Ohsweken, where my dad's from. And I'm a mom of three, so I'm not a frontline worker, but my husband is a physician, and we have a niece who's a paramedic who's also had the vaccine. Kind of had a little bit of the luxury of not having to work frontline, but I also have the fear of having family that is working with a sister and a husband and a niece who are all working in healthcare and getting us through this pandemic. So this vaccine has been something that we've been waiting for. I have three kids too, and they're right now are being homeschooled because their schools are shut down because of COVID. And this is something that we have to explain to them. They want to know. They worry about their dad. They worry about their Duda. They really worry about their Duda. They talk to me a lot about you, mom, and are you safe? And my oldest daughter, Skonahawi, she was like in tears because she was like, Duda, we have to keep her safe. We have to keep her safe. She has to get inoculated. Mom, she has to get it first because we have to keep her. She's the most important thing to us as a family. And so, our kids can't get the vaccine, right? They won't get the vaccine. It's only, I think it's like adults, right? And so, this is a really important conversation that I want to honor that fear, but I also think it's important that we discuss how do we move on and make sure that our people are safe and are informed and feel comfortable with this decision.
I think the main thing is that we're not being asked for our input, for our consent, and that's what worries us. And a lot of the elders that I spoke to, they expressed just about exactly the same thing. They said, I don't think they worked out the kink. What's the hurry and what happened in Israel? A lot of people got it. Well, they're worried that they're going to get that COVID. So, and also one of the main things that I'm concerned about is I'm old enough, and some of us are old enough to remember how badly we've been treated health-wise, and so that's still in our mind, and what happened to us in the past. And I'll tell you, that really shakes us up, we're scared, that, like myself, I'm afraid that my name might go on a list, and because I didn't take the vaccine, we don't know what's going to happen. We feel like we're being used as lab rats, and that's what they did in the past. If we say no, I mean, we're scared. I guess that's the main thing. We're going to be we're going to be disallowed from going into public buildings, and even maybe to grocery stores. One of the elders has to go down the street and get her groceries, and she's afraid of not being able to go, and maybe even losing our pensions if we don't sign up unless we get jabbed. That's what we call it, being jabbed. And so I think that's probably the main problems we're having. And Canada has already admitted that it committed genocide, and that was the genocide policy, to wipe us out. And so we're saying, oh my God, this is the final jab against us. And so we need to be given more information. We're not, because we're old, so they figure, well, we won't understand. And so what? They just have to tell us they're doing it for our good. But we have a lot of problems in our communities, and not so much here in Kahnawake as in many others. And I worry about those people. I love my people. And so I think we need to have Canada straight up and tell us what's going on.
I totally hear what you're saying. Absolutely, all of you. A system that has been harming us in the past is now saying they're going to give us something with benefits. So how can we trust that? So it's that kind of, how do we unpack that? I have to disclose that I actually did receive both vaccinations. And for me to make that decision was very conscious in regard to my own health, but also my family and the people that I work with. I am a frontline worker as well. And I have to say, for me, when I actually was going in to get the second injection, it was almost like, it was very for me, it was very spiritual. Like I very much that moment where it was like, yes, thank you, Creator. I'm going to be okay, and I can keep people around me okay. And that being said, it's not to influence anybody else. It was my conscious decision, knowing that, what's out there. And I have had so many folks, and I've seen so many people with COVID. I work in cancer, so I see, folks struggling every day, and I see our community, what it means to us.
So when I first was confronted with the idea of whether or not I should take the vaccine, recognizing that I'm the only full-time physician in my community, and I am the only person who goes all over the community and sees our very, very sick people in a number of different places, even in their own homes. And so I don't want to be a super spreader event and be spreading this virus to all of our most vulnerable people. So I realized that I have an absolute responsibility to protect myself as much as possible so that I don't become a super spreader focus. I don't think I could deal with the knowledge that I had infected a lot of people, even though I am trying as hard as I can not to. So I did get the vaccination, but I'll have to say that my initial response, or my initial feelings, were that I didn't want the vaccination. And I said to the people I work with that until I understand how it works, and until I can successfully educate and talk about this vaccine in a way that my children, as well as my patients and my family understand it, then I really shouldn't take the vaccination. So I have spent quite a bit of time talking about it and learning about the vaccination. So now I have enough understanding to be able to describe it and to understand how it works and its safety profile. And of course, I've talked with a lot of different Indigenous physicians across Canada, and have come to the understanding that I feel safe in taking this vaccination.
It's interesting that you say that. And Mom, I honor you. In our world, you are the most important person to us. And so, but we also understand, what we're going through. And what we've been through. And I, like I said, I'm not a frontline worker, but I remember in the beginning of this, this pandemic, when it started to, like, there was so much unknown and everybody was terrified. And I remember Keith would head off to clinic or do whatever, and I would just, like, the dread that I would feel, and then and that dread. And I think about, I think about there's so few people in the world, but especially in our communities, that can understand what a vaccine means. Like, and also I remember talking to Keith, and we were talking exactly about this, because I was kind of on the fence with you, like same as you, Mom, like, oh, I'm not going to take this until I see how it affects other people. And he looked at me and he goes, okay, Waneek, like, I've read about the clinical trials. He understands it. So obviously he understands all the technical information in it. And he goes, but what people aren't being educated about is you may recover from COVID, but all of those health issues that those people who survive COVID, what he says, there is lifelong health problems that they have. And he goes, we don't even know. He says, so, like, would you rather, like, get something that they've tested on people, or would you rather have a chance where you could get COVID and then have a myriad of health problems, which is a true thing. Because I have 3 kids that are like little petri dishes. We always talk about our children as being these little, like, they go out and, you can't stop a 4-year-old from licking some other kid's face. Well, I don't know where that's been, or they want to go to the park, or they want to, like, so it's been a really, like, me and Keith have really honest conversations about it. And I've had to kind of educate him as a non-Indigenous guy. Like, you're coming at it from a very logical point of view, but our people come at it from an emotional and historical pain point of view. So we really, really need to be proactive about balancing that and letting, you, Mom, know that it's your choice. If you don't want to get it, you don't have to get it, right? And that's, like, we'll protect that. But the thing is, you have to be ready to stay in isolation because of that choice until you feel comfortable. And when you feel comfortable, you can get it.
I feel like this is my feeling. I feel like we're being coerced. We're being scared out of our wits. If you don't take this, you're not going to get this. You can't go out. You can't go out. There's so many things you can't. It's not a list of rights anymore. It's a list of don'ts. And that's all you hear on the radio, on the television. That's all you ever see. And that is, for an elder person, it is very, very fearful for us. We don't know where that COVID is going to go afterwards. We don't know that,
Nobody does. Nobody does.
And so, we've gone through germ warfare. 95% of us were killed off. Okay, that was, and we're still we're still targeted. I think we still feel targeted. I'm just saying that. I worry about being jabbed. I worry about being jabbed for anything. But we see that we're watching. It's not like we don't see but then we're not given very much information. We're giving no information. So we have to figure it out ourselves, and we're not doctors. I would rather listen to you. And what about the medicines we have? We have a lot of medicines. And then are we going to all be a bunch of pill poppers, which is what we've become, a lot of us. And and then the hospital, it was called the place where you go to die. And that was very scary, to go to a hospital. So, so they're going to come into our house, or we're going to go to the Mohawk bingo, and that's where we're going to get it. They're going to say, roll up your sleeve. And
well, Mom, you don't have to go. That's the thing, is you make that choice. And if that's the choice you make, we as a family will help protect that choice.
But I would like to go there and see it and ask questions and talk to people, but then I'm not even allowed to do that, you know?
Well, Mom, if you go, like, for instance, like those places where they go do the testing and everything, those are like hotbeds of possible infection. You cannot go to those places, Mom. You can't, because people might be walking in there. They might be there. Like it's like the huge testing centers here in Ottawa. You can't go to them because there are people going that could have COVID and could infect you. So, you know, there's two ways you can look at this situation. The two is the fear and the situation as it is from more of a logical perspective. So you have people working in public health who are saying, oh my God, we got to get this vaccination out. You know, Indigenous people, most vulnerable population, because we have all of these comorbidities, we have overcrowding, we have all these issues that we already have in our community. Pile on COVID with that, and it's recipe for disaster. So you have these very logical thinking public health people going that and fighting tooth and nail politically to get the vaccines to our communities first, right? That's what they're doing. They're seeing it from saving our people. But you flip it to how it's being seen from the other perspective, which is what you're sharing, Mom, is, oh my God, they want us to go first because they want to see if we're going to die off, and then they're going to give it to everybody else. So that's the reality of just the two perspectives you're seeing here. And it's interesting because Ojistoh, your entire medical career has been you balancing those two things. I have seen you deal with it with Mom, with everybody. And it's like, you know, and Leonard, I don't know how you guys do it. This is like, you play on a tight wire. You are walking that tight wire, and you're so valuable as our healthcare workers, because without you, and you know, Mom, having gone through healthcare, without Ojistoh, where would you be? Where would I be? You know, and Leonard, I'm sure you have people in your life that have, you know, thank goodness we have Indigenous healthcare workers, because we trust them. And that's so important. So anyway, I just
brings a really important point about trust. No, in our own culture, no one person is going to understand or know everything. You can't, it's impossible to know everything. And so when we're born, we come with a bundle, a gift that as a family, as a community, we're responsible for holding the space so that child can maneuver their way through their adult child and adolescence and find their gift and become very good and have a voice to that gift. And then they become the expert. Mom, you always said, I don't care what you do, but whatever you do it well. And so we did everything that we're doing, and we're doing it very well. Doesn't matter what it is. And then when it comes to your turn and you have the expertise, and now your community, your people need you, you step up and you provide that expertise. And you need to trust that we have done everything that we can to learn that the best, most forward thinking, the best intentions. And so when I give these, that's why I know that's such a huge responsibility when I say certain things, because I know that what I'm carrying with me is a whole lot of history, but I know that my responsibility is so important, not just to say things without thinking them through. So that's why I initially said to the people I work with, I am not getting this vaccine until X, Y, and Z. Now I realize that I needed it, and I had thought about it, and now I can talk about the X, Y, and Z. But I have another thing. I have been within a foot of the face of people as they are dying from this horrific illness. And to watch our elders struggling to breathe and being unable to help them with the meager things that we have has been horrible, particularly because they haven't seen their families in a year. So I also have fear, not the fear of the far history and conspiracies and all these other things that are very real, but right now I have a bigger fear, and that is watching our own people suffocate to death. It's a horrible thing to watch. So you have to trust the people like myself that we're not doing this because we're jabbing you and we're gonna, you know, all of these other things. There's a whole other side to it, and it's our cultural responsibility to listen to people who have gone through this process.
That is a big, big problem, what you just mentioned. The fact that our culture says we're not supposed to believe anything. We have to sit and size it up. We have to get all the information in the consent. The Navigator provides all those tools, and we haven't even done that. We haven't sat
Some of us have, and that's the iron to go too, is that some of us have gone out and become experts at this. And our responsibility, if you follow the Kahentinetha, you taught me this, that you are responsible for knowing that information. And then when you're needed, you're brought to the front and you're supposed to be a voice to it. So we're both speaking about the Kahentinetha.
Yes, we are. Yes, we are. But the other part of it is that it teaches us to be suspicious. You know, we come with a lot of suspicions, and then as we sit there with everybody's input, whether it's small or big, then we figure it out.
Mom, with all due respect, what Ojistoh is saying, we don't have time in some respects, because we have people dying and potential outbreaks that Ojistoh is having to, and Leonard, you have to administer this. It's like, I wish we had all the time in the world. People wish we had all the time in the world to see and make sure. But that's why she's saying people like Leonard, people like Ojistoh, who have gone to get the education, who work the front line, who have, really understand. Ojistoh is not only a physician, but she's also an epidemiologist. So she understands even from all kinds of perspectives. You supported her through all of this education. You sat there, held her baby so that she could become our Mohawk knowledge keeper on health and wellness and this type of things. Now we are in a situation where we are in a very serious situation, and these are our warriors, are the Leonards and the Ojistohs. I 100% trust them. And if they say to me, Waneek, this is what has to happen for our people to ensure us, they are the ones that I trust. And we cannot undermine them. We cannot undermine our own people. That's lateral violence. And in this situation, with our people's health and well-being on the line, lateral violence, there is no space for it. We need to support each other.
Absolutely. I mean, we can't forget the history, and we've got to remember that that's who makes us strong Indigenous folks. I mean, we have a history, and it's a history that's very mistrusting in regard to, the healthcare system. And when you look at health equity, and you look at the social determinants of health, and you look at the justice system, and you throw that all together, and you got a dumpster fire is what you have. But we got to look to the future, and the future is, I need to be here, and I need my culture and my being, and I need, my sacred fire to make sure that there's another generation, right? And making sure that when I do, and I get the fact, that there's a lot of misinformation, and I think a lot of that has stemmed from, and I'm going to say it, from our neighbors to the south of us, and what kind of, forgive me, shit show that's been, right? Realizing that, we are not, or people feel that they're not getting the correct information, but also remembering that, who we are as people, we have got to obviously learn our own truth. And that comes from, we got to trust. Somewhere along the way, we've got to trust. We've got to make that leap of faith and trust for whatever reason, but it's for us. So getting the information and being able to make the decision for me and for you and for whoever, recognizing that this is a very, thing that's very, very personal and very, very sacred to me is who I am.
Absolutely. But Mom,
the question is, if anything at all goes wrong, anything.
When it will.
Yes.
And the whole reason why we take this, I can speak for myself, incredibly serious decision to go and have the vaccination. Don't forget, I'm your daughter. I grew up with all of the things that you're discussing. I definitely know all of the fear that you're describing, but I had to overcome the fear, which is an emotion, with knowledge, which is what I have done. And so, yeah, there's nothing is 100%. We all know that. And yeah, I have to take responsibility for what may come because of this, but I'm going with the best knowledge that I have right now. And this is what it is. And this is the decision right now. And of course, things may change in the future, because the retroscope, looking backwards in time, is a far easier thing to do than to look forward. And so right now, this is the best information that I have to look forward and to help us right now.
The thing, I want to tell you something. This is the first time that anybody ever talked to me about this issue. Nobody tells us anything. And this is the very first time that I'm hearing all these sides, except from Waneek and but a lot of people are sitting in the dark. They don't know what to do. They don't know where to turn. So I'm just thanking you for the fact that you have included me and you have listened to me, because nobody else does.
Oh, Mom, lots of people listen to you, and don't you worry about that.
Yeah.
Okay.
You have a resort of elderly people, and nobody really pays attention to them. So I'm sorry about that.
Yeah, it's
Yeah.
true. You're absolutely right, Mom. And that is a big problem with today's society. And that is a whole other amazing fireside chat we could have. I don't see any fire here, but the Gwadzuda, the fire of the family.
Oh, I see. I see fire. I see fire. I've seen fire. Right. I see it. Totally.